Francis Viola, patient presents for reevaluation of ulceration right hallux, also for surveillance of both his high-risk feet. Past medical history reviewed, no changes. Review of systems, denies any fever, chills, all other systems negative. Examination, ulceration, medial aspect right hallux, DP and PT pulses minimal, decreased digital hair growth, texture turgor reduced, distal critic sensation severely reduced. Area debrided, no sign of purulence or cellulitis. Some eschar, though, present. Assessment, stable ulceration plan. He will return to the office in 4 to 5 weeks, and we will monitor this until a better time to discuss correcting the underlying bone spur. Jeffrey John, patient is referred by Dr. Fraser, foot care secondary to diabetes, on metformin, examination, PT and DP pulses minimal, decreased digital hair growth, texture turgor reduced, keratoma plantar aspect right foot as well as fourth interspace left foot. Assessment, diabetes with PVD, multiple keratomas, treatment all areas debrided, patient returned to the office, PRN. Catherine Morello, patient presents with discomfort involving the right hallux. Examination, a nail ingrown, some rubor present. Remaining nails mycotic. Assessment, onychocryptosis with infection, onychomycosis. Treatment all areas debrided. Recommended to use micoside NS on the toenails. Should return PRN. Roy Morello, patient is referred by Kevin Miller for foot care secondary to diabetes. Examination, non-palpable PT pulses, decreased digital hair growth, keratomas associated with the nail plates. Assessment, diabetes with PVD, multiple keratomas. Treatment all areas debrided. He'll return to the office, PRN. Harry Krimmel, patient presents with discomfort involving both feet. Examination, 10 out of 10 nails, thickened yellow to mycotic, subungual debris and onycholysis is present. Pain from chewers inhibiting his activities of daily living. Assessment, onychomycosis. Treatment all nails mechanically and electrically debrided. Recommended to use micoside NS on the toenails. He'll return to the office, PRN, for reevaluation. Laura Horvatter, patient is referred by Dr. Sampson for foot care secondary to insulin-dependent diabetes. Examination, non-palpable PT pulses, decreased digital hair growth, keratomas associated with the nail plates. Assessment, diabetes, insulin-dependent with multiple keratomas. Treatment all areas debrided. Patient returned to the office, PRN. Roland McKenzie, patient is referred by his medical doctor, Dr. Dubin, for foot care secondary to insulin-dependent diabetes. Examination, non-palpable PT pulses, decreased digital hair growth, texture turgor reduced, keratomas associated with the nail plates. Has a rash in the first interspace, bilateral, no sign of infection. He is seeing Dr. Boyd in 2 weeks. Assessment, diabetes, insulin-dependent with multiple keratomas. Inflammation, first interspace, bilateral. Treatment, all areas debrided. Discussed with he and his wife treatment, which will include Silvadene once a day after washing with soap and water. He will see Dr. Boyd in 2 weeks for a follow-up on this area if it does not clear with this treatment. Ann Salisbury, patient is referred by Dr. Cogburn for foot care secondary to peripheral neuropathy as well as beginnings of PVD. Examination, DP and PT pulses reduced, distal critic sensation severely reduced. No digital hair growth present. Nails mycotic, keratoma associated with the distal end of the nail plates. Assessment, beginning peripheral neuropathy as well as beginnings of PVD. Treatment all areas debrided. Recommended she return in 9 weeks for reeval. Richard Allen, patient is referred by Dr. Ryan Stemma for foot care secondary to diabetes. Taking metformin. Examination, DP and PT pulses minimal, decreased digital hair growth, texture turgor reduced, keratoma, fourth interspace left foot. Assessment diabetes with PVD, keratoma, treatment all areas debrided, heel doing better with the ice stretches, moccasin foot also doing better. He'll return PRN. Robert Wheeler, patient presents with discomfort involving both feet, taking multiple medicines, mostly just for blood pressure. See enclosed list. He has no known allergies except to a CT scan dye. Examination, DP and PT pulses present. 6 out of 10 nails, mycotic, subungual debris, and onycholysis is present. Pain from shoe wear is inhibiting his activities of daily living. Assessment, onychomycosis. Treatment all areas debris. Recommended to use mycoside NS on the toenails or return to the office. PRN. Janice Wheeler, patient presents with pain, lateral border, right hallux. Past medical history reviewed, taking multiple medicines for several psychiatric issues as well as a heart condition. Examination, DP and PT pulses palpable, lateral border, right hallux ingrown, small amount of rubor present. Assessment, onychocryptosis. Treatment, offending spicular, the toenail debrided out. She'll return to the office when she becomes symptomatic again. Betty Ebettino, patient presents with an infected ingrown toenail involving the lateral border, right hallux. Examination, toe infected, infection mostly distal, extremely incurvated nail. Assessment, onychocryptosis. Treatment, toe was blocked with 3 cc's of lidocaine. Partial nail avulsion with nail nippers was performed. Patient was dispensed some bacitracin. She'll return to the office as needed. Note, patient is allergic to penicillin, had a hive reaction. George Ubaldo, patient presents with chronic onychocryptosis involving the right hallux. Examination, nail ingrown, pain with dorsal pressure, some rubor present. Assessment, onychocryptosis, localized cellulitis. Treatment, offending spicular, the toenail debrided out. Silvadine applied. Patient returned to the office. PRN. Laura Williamson, patient presents as a referral from Dr. Baez for foot care secondary to PVD. Examination, non-palpable PT pulses, decreased digital hair growth, texture turgor reduced, multiple keratomas associated with the nail plates. Assessment, PVD, multiple keratomas. Treatment, all areas debrided. Patient will return to the office. PRN. Frederick Lopez, patient presents with pain, sub 3 right as well as right and left hallux nails. Past medical history reviewed. No changes. Review of systems denies any fever, chills. All other systems negative. Examination, DP and PT pulses reduced. Distal upcritic sensation reduced. Inflammation and some bleeding in the callus noted. Sub 3 right. Nails mycotic, several ingrown with pain. Assessment, onychocryptosis, positional deformity with inflammation. Treatment, all areas debrided. Patient will return to the office. PRN. Catherine Lavan, patient presents with an infected ingrown toenail involving the medial border of the right hallux. She has seen Dr. McCullough, who gave her some upiricin for it. Examination, nails, it looks rubrous. I see no drainage. Assessment, onychocryptosis with infection. Treatment, the toe is blocked with 3 cc's of lidocaine plain. Partial nail avulsion with nail nippers was performed. She'll continue with imupiricin and return PRN. Charles Powell, patient presents as a diabetic under the care of his medical doctor. He's been diabetic for approximately 10 years, taking 2 medicines, including Januvia. Blood sugar has been slightly elevated, glucose A1C in the 7 range. Blood sugar this morning 180. History of chief complaint, cut the 5th digit and 3rd digit toes, not realizing it while trimming his nails this morning. Past medical history, see enclosed list of meds, review of systems, denies any fever, chills. Examination, new DP and PT pulse is palpable but reduced. Distal upcritic sensation severely reduced. Several small cuts noted on the bed of the nail, 5th digit left as well as 3rd digit right. treatment. Patient was placed on Bactroban ointment twice a day. He'll return to the office in 1 week for re-eval. Elizabeth Purple. Patient presents with pain involving the right hallux as well as underneath the fibular